So, to be honest with you, most doctors, including myself, and I suppose we could probably include nurses in this, and other medical professionals, we know more or less just about as much as the public knows when it comes to nutrition. And one of the stories that I was led to believe, and I think all of us were more or less led to believe, is that most chronic diseases are primarily genetic and or a normal consequence of aging. Have you guys heard this before, or maybe led to believe this as well? So for me personally, I did believe this, and it had me very worried personally. And I was worried personally because of my family history. I'm going to share with you some of this in a moment, right here, right now. So my grandfather, my father's father, had a heart attack, his first heart attack. He actually had two, but his first heart attack at age 38. Now that's pretty young. And he went on to have a bypass surgery in his 60s, ended up with kidney failure, and was on dialysis in his 70s, and died, unfortunately, of a second heart attack at the age of 79. Now, if that's not bad enough, my own father had his heart attack at age 45. And maybe that's a little better, but still very young. Had a heart bypass surgery as well at age 53. He was obese, or is obese, type 2 diabetes, high blood pressure, sleep apnea, retinopathy, which is eye damage from diabetes, couldn't see very well. Fortunately, he is still alive, but are you guys worried about me now? A little bit. Can you see where I'm coming from? Okay. But there was one problem, one more problem my father had, which I think it's important I share with you all. And if anybody's squeamish, you're welcome to close your eyes, because I'm going to show you a picture that might upset you a little bit. I know we just had breakfast, but I do want you to see it if you can. Ready? You guys are quiet now. Very quiet. So this was my father's left foot about 6 years ago. And this is diabetic gangrene, for those of you who haven't seen it. And his doctors tried as best as they could to save this foot. And unfortunately, things didn't go very well. And not only did he have to have his foot amputated, he had to have his leg amputated. He had a below-the-knee amputation. And you can only imagine, I'm sure, how difficult this must have been for him personally to have to accept this and to have to adjust. He ended up getting a prosthetic leg and had to learn how to walk again. But it's been really hard on him and the family. But guess what? Unfortunately, I kid you not, the story gets even worse. Because 6 months later, as he's learning to walk with his new leg, his prosthetic leg, unfortunately, his right foot develops a problem. I think probably what happened is he was putting more pressure on the right foot and ended up getting an ulcer or a wound in the right foot. And this, I wish I could tell you that this turned out well, but it didn't. He ended up having to lose, again, not only the foot, but the other leg as well. And this was within a span of about essentially a year. So he went from a walking, driving, working, very functional man, who, by the way, was looking forward to, for so many years, having grandchildren. And we had just given him his first grandchild about 6 months before this all started. So he was so looking forward to playing and running around with the grandchildren, or first one at least, and then this happened. So you can imagine, again, how devastating this must have been to him and to our family. Now, he is alive today. We're so grateful and blessed he's alive, but it's so much harder for him to live now, given this reality. Now, going back to myself, as I'm seeing my father go through this, I mean, you can only imagine what I must be going through personally as well, not only feeling bad for him, but really worried about myself, especially knowing about the heart disease and now this. And I thought I was doing okay. You know, I didn't drink, I didn't do drugs or smoke. I drank diet soda. I mean, that's going to keep me healthier. I ate some salad, you know, some blue cheese, and, of course it had some blue cheese and croutons and bacon bits in it. I ate more chicken than red meat because I thought, I've been told that was good for me. And I had low-fat milk and did my best to control my portion sizes. I was always told that portion control is the key. Didn't eat much candy, didn't have dessert every day, and when I did, I shared it with my wife, so that had to have helped. And I tried my best to get regular exercise. I wasn't always consistent, but I did what I could, but yet somehow I wasn't doing well. At the age of 38, this was 4 years ago, I'm 6'2", weighed 255. My body mass index was 33, which puts me as obese. My weight was yo-yoing up and down for years. I kept struggling with it. I had pre-diabetes, actually. I had something called fatty liver, which is, for those of you who don't know, inflammation in the liver due to fat accumulation. I had acid reflux on nearly a daily basis. And I was told by multiple family members that I definitely had sleep apnea, although I wasn't tested. And I was really worried I was following in my father's and grandfather's footsteps. And to be quite honest with you, I don't know how many of you felt this way, but when you're yo-yoing up and down and it's just not working and you're really worried, I began to feel like a failure. I felt like I just can't do this. I mean, I must not be good at it. I've failed. I'm a failure. And I really thought I was doomed by my genetics and my family history too. And right around this time, my wife and I were starting a family. Like I said, we gave my parents their first grandchild. And so these are my girls. And this is Gabby on the left. She's 7, and Emmy on the right is 3. She's just celebrated actually, we're celebrating her birthday today later. And I had much to live for. And so you can only imagine what's going through my mind, thinking, gosh, if I have a heart attack and I, God forbid, die, I'm going to leave these beautiful children and my wife and my family and everything. But this may not be very logical, but this is true actually. 1 out of 3 people who suffer a heart attack die of the heart attack. And I was thinking, my father didn't die, my grandfather didn't die. That's 2, so I'm going to be the 1 out of 3. And the other aspect to this too is I'm a doctor, and I felt like, what kind of a role model am I to my patients when they come to me and ask me for help, to lose weight, to help them with their diabetes? What kind of role model am I? I couldn't do it for myself. And so I was really at a crossroads. To be honest with you, I would say that I was probably a little bit depressed, but I think I sort of hid it. Because I had to be functional, I had to, be a good doctor, do the best I can as a doctor, be a family man, be a husband, be a father. And so there was, I think, a certain level of depression and probably anxiety about all this, but I kept it sort of buried. And all of this changed. My whole life changed on one day. I'll never forget, December 26, 2012. That's the day after Christmas. On a car ride coming home from a vacation from San Diego, my wife and I and one of our children. And my wife puts on in the car an audiobook. My wife loves audiobooks, and I actually asked her to not put the audiobook on. I had no idea what it was, to be honest. And I just wanted to relax and hear music. And I'm so glad that we listened to this audiobook. Happy wife, happy life, right? So. Because this audiobook really changed my life, and I've read a lot of other books since then, but this was Dr. Fuhrman's book, Eat to Live, and it was recommended to my wife by a cousin and a friend of ours who had really good results with it. And when my wife put the audiobook on in the car, I'll be honest with you, I really wasn't even paying attention to it. I was sort of half listening to it, just very passively listening, but yet, as I was sort of half listening, I heard some things that really caught my attention. Some of the things I mentioned in the beginning, how you could eat as much as you want and lose weight, how people can get off of medications and reverse their chronic diseases. I'm thinking to myself, I've never heard this before. And so initially I was very skeptical, but then he really went through a lot of the science and a lot of the common sense and logic with it. And so I started to really think on that car ride, wait a second, what if there's something to this? And so it encouraged me to read the whole book, and since then, I've read a few other books. And actually, what's really cool about this conference is I've looked at the authors on some of my favorite books, and I think about half of them are speaking this weekend. 2 of them spoke last night, Dr. Polday and Dr. Letterman. And what I've learned in my research on plant-based diets is that the benefits are really head-to-toe, life-changing benefits. First of all, weight loss without portion control. I've never heard that before. Regardless of exercise. Now, there are so many benefits to exercise. You should exercise. But even if you don't, you'll still lose weight. Most people, if you do a decent job eating this way. But besides weight control, prevention and reversal of so many conditions, heart disease, many cancers, diabetes, hypertension, even erectile dysfunction, kidney stones, gout, and multiple GI, gastrointestinal conditions. And, it'd be one thing if it just made us healthier, but it also makes us feel better. So improved quality of life, energy level, mood, and pain.